This video demonstrates our X-shaped gloss stitch suture technique using standard arthroscopic instruments. The authors have no conflicts of interest to disclose. A standard lateral portal is established, and a horizontal tear of the lateral meniscus is identified. After careful evaluation, degenerative tissues at the peripheral edge is partially resected. And then socialized using a radiofrequency device. The tear site is then refreshed with a diamond rasp to promote healing. Meniscal repair is initiated. First, a 205 fiber wire is passed through the peripheral part of the posterior edge of the tear using a meniscopion. Then the opposite side of the same fiber wire is reloaded into the scopion and passed through the meniscus approximately 10 mm anterior to the initial stitch. During this step, care must be taken not to entangle surrounding the soft tissue, such as the portal site or infrapatellar fat part. After passing the suture anteriorly, both ends are pulled to introduce a loop into the joint. If any tangling occurs, it should be resolved before proceeding. A suture retriever is inserted under the loop to grasp the anterior limb of the fiber wire and retrieve it through the portal. Both suture ends are then pulled to tighten the stitch. And the knot is tied to secure the repair. It is important to position the knot as peripherally as possible to avoid intra-articular irritation or mechanical impingement. The knot is secured with 3 half hitches and the suture is cut to complete the stitch. Additional sutures are placed in a similar fashion depending on the extent to the meniscal tear.